This is Dr. Neal Mauldin for PetCure Oncology. Today I would like to talk to you a little bit about using stereotactic radiosurgery to treat patients with brain tumors. And I'd like to do that by showing you a case study and sort of taking you all the way through from start to finish exactly what goes in to treating a patient with this kind of radiation therapy technology. To start, I would like us to take a look at the CAT scan because that's usually where most of our patients get diagnosed and certainly a very critical part of preparing a patient for being treated with stereotactic radiosurgery. So this is the CT scan of a 12-year-old beagle who presents with a history of late onset seizures. So she had been a completely normal dog up until a few weeks prior to this CT scan when she started to have seizures. And that is a fairly common finding for us in the world of radiation oncology. When we have an older dog or cat that begins seizuring, tumor really is the first thing we think about. So to orient you a little bit, this little one is laying on her chest, so her chin is down here, top of her head is here, right's on the right, left is on the left. We are sort of midway through her muzzle now. We're sort of right at the level of her eyes. So these structures, the larger structures of the globe of her left and right eye, and then these denser structures are actually the left and right lens of the eye as well. As we move on back, we get into the brain. So this is the very front part of the brain. And even at this early of a slice, we can see that there's an abnormality on the right side relative to the left. So we're seeing that there's some asymmetry here. She's very straight in her immobilizer, but we've already got some asymmetry at the very front of her brain. And as we move further on back, that becomes quite pronounced and quite dramatic. This is a tumor type called a cystic meningioma, so fairly common tumor for us to see. And it's in a part of the brain called the olfactory lobe, which is we also call it the silent area because many times dogs with tumors in that portion of the brain don't have any clinical signs at all other than those late onset seizures. And as we move further back, we can see that the tumor is still quite well defined and fairly large. If we look at a top-down view, so now we're looking from the top of her skull down through. Right and left are reversed for us now, and you can see this is all tumor here. So she's got a fairly large, fairly extensive volume of tumor. This is all normal brain, and again, the left and right eye and left and right lens. And as we sort of scroll back and forth through, you can see that this is a fairly significant lesion for this little one. Again, she's doing surprisingly well. She has no clinical signs other than those late onset seizures at the time of this CT scan. Switching gears a little bit, let's take a look at the radiation therapy planning side of things. So these are what are called volumetric reconstructions. So this is actually her head contour as it's created by reconstructing those two-dimensional CAT scan slices into 3 dimensions. And so this is a fairly good representation. All of our planning software is human-based, so we don't get any fur or any features like that to help us out, but that's a beagle head, I think, for the most part. And we can turn on other structures as well, so we can turn on and see the left eye and lens and the right eye and lens. This pink structure is the normal brain, and then this structure and really this bright red structure is the target volume. So that's where we think the tumor is, and that's where we want our dose to go. if we scroll in a little bit and sort of take a look at this tumor in a little more detail, again, we can see fairly large volume considering, and we've got this tumor that's sort of nestled right down in between the left and right eye. So it's a good location to have a brain tumor from the fact that these patients usually don't have really significant clinical signs. Certainly we can see much more severe signs if we had a tumor here in the midbrain where the thalamic core lives, or perhaps even a more dangerous location would be in the back in what we call the caudal fossa, because those patients can get into trouble due to high pressure. So good place to have a tumor from a normal brain function perspective, but you can see we're kind of tucked down in between the left and right eyes, so we're going to have to work a little bit to treat this tumor while sparing the normal structures that are surrounding it. If we look at her treatment geometry, we can see that she's being treated in two arcs. So first the gantry rotates 360 degrees clockwise, then it comes back 360 degrees counterclockwise, and in that time it delivers our prescribed dose of radiation to the tumor. Using these arcs allows us to do two things. It really allows us to come at the tumor from just about any angle we can imagine and try to find a way to get the best dose of radiation into the tumor that we can. And it also allows us to break the dose away from these normal structures so that we can, not have as much dose coming through in this area where would be coming through the eye. The machine can decide to really scale back the radiation dose and maybe push a little bit harder in some of these areas that there's not a critical normal structure. The next thing we can look at is what's called the dose cloud. So we can turn the dose cloud on. Let's actually turn it down to about 15%. We can turn the dose cloud on and see sort of these little dots and speckles, and those are the computer's attempt to show us what the dose in 3 dimensions actually looks like. Dose clouds are a lot like weather maps. The bluer they are, the colder they are, the redder they are, the hotter they are. And so you can see that when we're down at this 15% dose, we've got a lot of blue, but it's a lot of blue that's in non-critical structures. And if we look at the eyes, we can see that the left and right eye are actually quite well spared from the radiation, and the lens, which is the structure we're really concerned about because it's a very radiation sensitive structure, is very well spared. And then if we turn up the dose cloud, and typically the dose line we want to see is the 95% dose line. So if we take a look at the 95% dose line, we can see that the radiation is very nicely targeting the tumor while sparing most of the normal brain. I mean, obviously there has to be some brain dose since the tumor is within the brain, but we've got a good dose to the target volume while sparing our normal critical structures. And that's really the strength of stereotactic radiosurgery, especially when it's delivered as arcs, in that we get sort of the best of both worlds. We're able to really finely target the tumor and push a large dose of radiation into our target volume, while simultaneously sparing the normal critical structures that are oftentimes surrounding the tumor and making it difficult for us to treat effectively. There, as I said, for tumors in more dangerous parts of the brain, for spinal tumors where we have very little room for error, the capacity to deliver our prescribed radiation dose in arc fields is a very important important component of treatment. The last thing I would like us to look at is something called Radiological Report. And this is, we think, a very critical part of the overall quality control standpoint, and also an important way to ensure that another set of eyes has looked at a plan and that there is a fairly robust approval process in place. So what Radiologica is, it's a software program that's used on the human side to apply metrics to different structures within a treatment field. So we can have metrics that are relating to the target itself, so we can be sure that we're giving the dose of radiation that we want to the target, and that we're meeting sort of those critical dose steps that are important for inducing a remission or gaining some measure of control. And just as important, we can look at dose metrics to the normal structures and be sure that we're not pushing a target dose in a normal structure above where it should be. PetCure is the only veterinary radiation oncology program that uses Radiologica to apply these metrics, and more importantly, every single PetCure plan has to be approved by a second radiation oncologist. So this is a test case, but if this was a patient that was being treated, then you would see that I would be the planner, and then before this plan could be released for therapy, it would have to be reviewed by a second PetCure radiation oncologist and ensure that the metrics all fall within acceptable ranges, and then released for treatment for that individual patient. So at the top part of the report, really what we see is just sort of a plan overview or a patient overview describing what we're treating, what the prescription is, things of that sort. The metric values are really where the most important part of the report is. And this is, we see things like this. So PTV, that is that target volume we talked about, the thing that we're most interested in getting a good dose to. And you can see here that we didn't quite hit the range that we wanted, but we did meet an acceptable variation. Sometimes you just can't hit a metric, and that's because there are constraints between what you can achieve in the tumor and what you may be able to achieve in surrounding normal tissue. So this report actually looks very good, but every once in a while we'll have to make a choice between treating the tumor effectively or giving a dose of radiation to a structure that's outside of our accepted protocol. From a patient perspective, it's almost always better to treat the tumor and realize that you may have to deal with some radiation side effects rather than back off on treating the tumor in an effort to spare. But for this particular plan, you can see that our tumor metrics, so the PTV metrics are very good. We're happy with both of those. And then our critical structures, so the brain, the left and right lens, are also all well within tolerance. And we're very happy with the normal tissue constraints as well. So for this particular patient, this plan would be approved and it would be released for therapy, and then we can get that patient scheduled, get them treated. The final piece of the puzzle, and again, since this is a test case, it's not showing us all the data, but each one of these cases is stored in a master database so we can compare back to them. So if this was an actual patient that was the treatment data was being used for therapy, we would see that we would see all of the data here for how every other patient had performed. And the long-term goal there is to be sure that the metrics we're assigning are actually the metrics that we're happy with, and that we're getting the results that we want from that. This is actually a real-world patient. It's just that this data is all anonymized and not used for therapy. She was diagnosed about 3 years ago, and we just recently lost her to a completely unrelated problem when she was a 15-year-old beagle. So brain tumors and stereotactic radiation can go very well together, and especially when we're talking about doing appropriate quality control and when we're trying to minimize our critical structure dose while at the same time maximizing dose to radiation therapy. So again, hope you found this little case study helpful. This is Dr. Neal Mauldin for PetCure Oncology.